I'm Dr. Thelen, a physician at Family Medical Specialties. I practice full scope medicines like the MDs here in clinic. I see all ages. I do OB, pediatrics, geriatric care, but I also have somewhat of a subspecialty in osteopathic medicine. Osteopathic medicine, also called OMT, which stands for Osteopathic Manipulation Therapy, is a whole philosophy branch of medicine in which we use hands-on techniques to treat multiple different musculoskeletal ailments. OMT can treat acute pain, chronic pain. It can be for back pain, neck pain, extremity pain. It's also very helpful for tension headaches, migraine headaches. We can even use it for sinus treatments. It focuses a lot on realigning anatomic structures, muscles, bones, lymphatic tissue that are out of place. When these structures get out of place, that's when we get resulting pain, aches, spasms, swelling, etc. So this therapy is aimed at physically moving those structures back into their proper anatomy. We generally treat once, and our philosophy is find it, treat it, leave it alone. At that point, we usually have you doing strengthening and stretching at home, using a heating pad, doing those supportive cares. So I like to think that I move those structures back into place, but I have you maintain them. So coming to an OMT visit is really about like coming to any other doctor visit. You come, you check in, you're roomed by a nurse who's going to ask you some questions, take your vital signs. I'm going to go through a history and exam with you like I do for all my patients, but then we spend some extra time just doing the manipulation therapy. There's not a lot you need to do to prepare for an OMT appointment. I think it's helpful for me if you have a good understanding of your history. I'm going to want to know if you have things like osteoporosis or a history of vertebral fractures, or if you've had surgeries where maybe you have some rods and hardware in your spines or your extremities. That's always good for me to know. But really just kind of being able to pinpoint where your pain is and what exacerbates that pain is good for me to know. And we'll work on that area, but I can usually find aches and pains that you didn't know you had as well. I like to describe the modalities as a little bit of a modified combination of physical therapy, massage, and chiropractics kind of rolled into one, and specified towards whatever the ailment is, whatever the pain is that we're experiencing. We kind of mold the treatment for that ailment. In a sense, it's a little like going to a chiropractor in that we will do some adjustments. We tend to have very targeted adjustments. And there's a little bit more soft tissue and physical therapy type techniques. So a little more massage, and then techniques such as muscle energy, where we place the patient in a certain position, have them resist against us, and we're using the patient as the activating force to move that anatomic distortion back where it needs to be. So for best long-term results, it's really important to stick with the stretching regimens that we recommend, heating pad, ice, all the supportive things that we go through at that visit. If you're interested in trying osteopathic manipulation therapy, just give our clinic a call and schedule an appointment. Be sure and mention to the front desk reception that you are looking to have an OMT appointment, or if you call it a back adjustment, because then they give us a little bit longer appointment slot.